uh, for today's Southeast Network session. As you all know, the session is being recorded. Um, so just you can introduce yourself by taking advantage of the chat and putting your name, your state, and your whether or not you're a community health worker or ally. We're glad to see you all here. Um, we got a full agenda today, so we're just going to go ahead and get started. We have a speaker today on accrediting organizations, not individuals, Tennessee Community Health Worker Association Innovative Statewide CHW Program. And the speaker for today is Nikayla Board, who is the ED of this Tennessee Association. And I'm glad to be able to introduce to Kayla today for a couple of reasons, and I'll save that until at the end. But the Kayla Board served as the inaugural executive director of Tennessee Community Health Worker Association with over 10 years of experience in managing and developing CHW and community programs. She guides teams of community health workers. Under her leadership, Tennessee Community Health Worker Association spearheaded efforts for CHW certification and program accreditation. Nikayla is a member of the National Association of Community Health Work, whoo and the Southeast Community Health Work Network, and serve on the advisory board of TUS Salud at Latino Memphis. So I present unto you now, Nikayla Board.
Good morning, everyone, and thank you, Lily, for the introduction and glad to see your face. Uh, Hope I get to meet you in person soon. Again, we met a
Yes.
long time ago, but I want to see you again. Um, y'all, let me see if I can get my screen to share correctly. Uh, of course, I never have issues until it's time to present. So
Hmm.
if you will let me know, I'm going to share my screen and then pull up my slides. And do you all see my slides? Okay, perfect. Okay, so as Lily mentioned, I am the executive director for the Tennessee Community Health Worker Association, and really excited to be here today just to present about our program accreditation. We'll have, of course, time for Q&A at the end, but if you have any questions, if you can drop them in the chat, that would be great, and hopefully I'll be able to answer them. But just a little bit of background on the association. We began in 2016, and I see one of our leaders here on the call today, Barbara Clinton. I have to call her, shout her out. She helped us to actually form the association. Barbara and a host of others began working on Tentua, trying to pull Tentua together as early as 2016. We began as the Community Health Worker Collaborative, and then from a coalition of healthcare and community-based organizations like Ballad, the Meharry Vanderbilt Alliance, Siloam Health, Department of Health, Methodist Labarna Community Outreach, and a host of other organizations in Tennessee, realized we needed a formal association. And so that collaborative collected data, and our association formally began in 2021 with the support of a strong steering committee, and we became an official nonprofit in 2022. Our mission is to support CHWs individually and as a profession to advance a healthier Tennessee. And as Lily mentioned, I'm Nikayla. I'm the inaugural executive director of Tentua. I began work in CHW work rather in Memphis in 2016. I served as community health worker and program manager at a local hospital in Memphis, director of community programs at a university, and then took this ED role in 2021. Again, I love this work and I'm excited to be able to share more today. So just a little bit about some of the programs we offer. We do offer membership, finally, thanks to Lori, one of our staff members who's here today. And I did forget to mention, we are a staff of four. We began with me as part-time ED and have since advanced to a four-person staff. Still not enough, but everybody's doing an excellent job. And I think some of them are on the call today, but we have Lori Hoffma, our Director of Operations and Programs. Bree Burke is our Program Manager, and we just hired a training coordinator, Jensen Pierman. But we officially launched our membership program February of last year, and it is open to all. Our portal is at tenchua.org, and it's open to individuals and organizations. We offer networking, peer-to-peer support, training, and other opportunities. We also offer individual training and certification. So Tennessee doesn't have a formal certification process, but we were partners with Vanderbilt and the Rural Health Association on the recent HRSA grant that ended in March of this year. And we've trained over 260 CHWs. Several received, or all of them received a Tenchua and Vanderbilt certificate, and then quite a few others were apprentices, and they received a Department of Labor certificate through the Rural Health Association. We are relaunching our training program thanks to some funding from United Healthcare. We're actually hosting an informational this Thursday, and we can share that information later for people who are interested. And our training is competency based and is focused on CHW workforce development. So, individual training and certification we offer. And what I'm here today to talk to you more about is actual program accreditation. So, here is where we accredit the employer, the program, as opposed to the individual CHW. So we partnered with TennCare, which is our state Medicaid office, to pilot a CHW program accreditation initiative. So the accreditation focuses on the CHW program, as I mentioned, or the organization, not the individual CHW. So at the end, organizations that are accredited, they receive a certificate. And we'll talk more about that later. But again, it's for the overall program. I know people get confused, particularly when we talk about this, because you've got certification for the individual. We're also, I know at the national level, looking at how to accredit curricula or training programs. The one I'm talking to you today, though, is about accrediting the actual organization. Okay. And so the goal is to ensure that agencies or organizations are meeting the standards that are grounded in best practices, quality programs, and the C3, which I know they have a new name and I always forget what it is, the C3 CHW competencies. But Tenchua, we worked with CHWs, community-based organizations, healthcare systems, academic institutions, clinics, the Department of Health, and other people to develop 7 accreditation standards. And I'm going to show you a glimpse of what they are a little bit later. But the programs have to submit evidence and meet scoring requirements under each of the 7 standards to receive accreditation. And I can't stress enough that these standards were built with CHWs at the center. CHW showed up to meetings. Barbara facilitated those meetings, and we were all able to agree on 7 standards that we believe organizations should meet to prove or to receive their accreditation, rather. And so the way this worked, TennCare awarded several organizations funds to participate in program accreditation. They currently receive training from an outside entity to assist them with preparing for accreditation. And to date, 16 programs have been accredited, and we currently have 7 additional programs going through cycle 2. And I forgot to mention, we started this in 2023. And so we're at the end of the 3-year pilot this year. So we're using lessons learned from the pilot to explore long-term sustainability options for CHW services and programs. Um, we're grateful that TennCare has continued to keep the CHW voice rather centered throughout this process. And our hope is that this could lead to CHW reimbursement. We know that reimbursement is not the only way to sustain CHW work, and we can't rely solely on that, but it would help if we would have something in place for that. To date, we haven't figured out reimbursement, but we strongly believe that this program could lead to that. And TennCare has been committed to helping us kind of figure that piece out. So I'm hoping we'll have better news to share in the future as far as us having reimbursement approved in Tennessee. So, just a little bit more about the program design. Um, After our CHWs met to design the standards, and CHWs and other organizations met to design these standards, we partnered with the National Committee for Quality Assurance, NCQA, to develop the process and the procedures. And so, what you're looking at now are the eligibility requirements for CHW organizations. So, the program criteria, they must employ CHWs that meet the APHA CHW definition um, and have core responsibilities and functions that align with our program standards. They have to have at least one full-time or equivalent CHW employed during the accreditation process, or part-time employees that add up to one full-time. And we did that because we know that some of our organizations can't afford full-time CHWs. We have quite a few that hire part-time CHWs. And so we wanted to make sure that these being accredited was accessible to all. And so we also make sure that the CHW responsibilities are being covered at least 50% of the time if they are working as a full-time CHW. The reason that we did that, Tennessee is a rural state, and we know that sometimes CHWs play dual roles. And so we wanted to make sure, again, that this was accessible to all. But we do um, make sure they have to prove that the CHWs are carrying out CHW responsibilities at least 50% of the time. Um, then they have to complete an accreditation application and a letter of commitment, either signed by executive leadership or their board of directors, just stating that they're okay with the organization going through the accreditation process. So here is the actual process. They apply. We review the applications and make sure they meet the minimum requirements. Then they upload their documents that the reviewers will review. Then there's a preliminary document review just to ensure that all of the necessary information has been uploaded. And there's a preliminary criteria review. So our reviewers check the content of the documents against the defined criteria. And I can't remember if I included this in the slides, but I just want to take a moment here to say that our reviewers are from Tennessee. So these are the people who conduct the site review. And I might be getting ahead of myself. But the reviewers, they go out in pairs. One reviewer must be a CHW. We do not conduct any reviews where a CHW is not present because CHWs know the work, they're related to the work, they're still in the field, and they can help the other reviewer to understand what CHW work actually is or is not. So we take pride that a CHW has to participate in every single review. The other reviewer must also be knowledgeable about CHW work. So we did have application processes. Our reviewers are trained and retrained every time we get ready to conduct a site review. So site reviews, this is the next step. They're either virtual or in person. And this is where the reviewers meet with the organizations to discuss the documents they've submitted. And they usually take about 8 hours. And the CHWs also participate in an interview. So the site that we're reviewing, we randomly select at least two CHWs, if they have two CHWs on staff, to complete interviews where we actually talk about what they're doing in their day-to-day roles. After that, there's an executive review where we check the quality assurance after the site review. Then after that, the decision is conveyed. Organizations receive a scorecard if they pass or fail. Organizations must score 50 of 54 points to be accredited. Accreditation lasts 3 years, and organizations that receive below 40 points have to reapply when the next period opens. And organizations that score 40 to 49 can request a re-review within 60 days after they address any insufficient documentation. And I'm getting on my end that my Wi-Fi is unstable. So if there's an issue with you all being able to hear me, please let me know. So just for a little more insight, here are the 7 standards: recruitment and hiring, CHW scope of work, supports for CHWs, CHW training, CHW performance evaluation, CHW professional and workforce development, and CHW supervision. And each of these standards is broken down into competencies, and followed by that are the criteria that we're looking for to ensure that they meet the standards. And again, these standards were designed by CHWs and other organizations with nonprofits, community-based organizations, clinics, and hospitals in mind. We wanted to make sure that these standards are applicable to all types of CHW programs, so they are not focused solely on clinics. These are transferable across different types of CHW programs. And if you're interested in learning more, our standards are posted on our website. Does this slide show up as blank for you?
It does.
Okay. Oh,
Oh
I
no,
forgot.
there it is.
It's a little fancy. I forgot that it has a transition. So this is just an example of what our standards look like in more in depth. So this is the CHW position core qualifications. So organizations have to show documentation of that they're looking for CHWs with shared lived experience, cultural humility, previous work or volunteer experience. So all of the things that we know makes a CHW a CHW. And so they'll have to upload a job description that matches all of the criteria above, or any other documentation like a resume, application, a bio. Okay, so this is what they upload, and our reviewers check to ensure that they've met the standard. So this is just one example of how the standard looks and what we're looking for. And so for us, the importance of accreditation, we believe that this model is beneficial because it focuses on improving the quality and consistency of programs. It provides a framework of what strong CHW programs should look like. And you can just go back and kind of look at our standards just to see what we mean there. It strengthens credibility and trust. Accredited programs demonstrate to funders, healthcare systems, and other partners that they are committed to quality standards and meaningful CHW integration. And CHW integration is one of the criteria that they have to meet. And also, they are accredited by their statewide association. I would think that says a lot to the community and to their clients. Important. This rather supports the CHW workforce retention and satisfaction. Programs, and again, if you take a look at the standards, you'll see what I mean. Programs are encouraged to create healthier work environments for CHWs through proper support, professional development, equitable practices, and the recognition of the CHW role. It promotes better health and community impact. It emphasizes culturally responsive, community-driven practices that help organizations better address social determinants of health and improve outcomes, creates a pathway for sustainability. Again, we haven't figured out reimbursement, but organizations that have been accredited, we believe are better positioned for partnerships, funding opportunities. We tell people when you're applying for grants or you're meeting with potential funders, let them know that you've been accredited by your state association. So that's one piece of sustainability. And the other, again, we hope it will lead to reimbursement. It encourages accountability and continuous improvement. So rather than being a one-time recognition, we're hopeful that organizations will continue this work so that they can be reaccredited. And again, it centers CHWs. CHWs have been helping us to develop accreditation since day one. And their voices are heavily reflected throughout each standard. And we're really proud of this model because it's the first of its kind that we know of anyway, in any of the states. We know that there are organizations now that are rolling out this process, but at the time when we developed it, um, we were the first to do this. And I can tell you, we searched high and low because if we didn't have to reinvent the wheel, we did not want to. So we did, again, this is one of the first of its kind. And so just some of our successes, wanted to highlight the organizations that have been accredited in Tennessee. Siloam Health, Methodist Labarna Community Outreach, Mental Health Cooperative, Regional One, Senior Solutions, LifeDoc Community Health Worker Program, Meharry Health Solutions, Ballot Health, Family Care Wellness, and Homeland Heart. I wanted to call these out in case any of them are on the call today. If they are, they can tell you that it was a grueling process, but they did it. They've all been accredited. And it was definitely not easy. They did have some time constraints because this is a grant. Ideally, we would like for organizations to have up to a year to prepare. In some cases, these organizations had 6 weeks to prepare, and some of them did even obtain perfect scores. So we have CHW programs in Tennessee that have already been doing the work, and we were able to highlight them through this process. And we currently have 7 more programs that are undergoing the process right now. They are uploading documents. And if any of them are here today, hopefully you will be encouraged just by seeing that other people survived. And you definitely will too. So just again, some of the other notable successes. We already mentioned that this is an innovative approach, first of its kind. Already mentioned it was designed through CHW collaboration. Um, I think one of the biggest things is shared responsibilities. We've collected data and information from the reviewers, from the accredited programs and the partners, just to make this process better for future organizations. They were able to share. And so we've been using that feedback throughout the process, just to make it a little bit more smooth for future organizations. Same thing as far as evaluation. We've gathered all this information and hope to we have 1 more year of funding, and we're going to conduct a comprehensive evaluation in the final year. Strengthen policies and systems, of course, helps the organizations to build stronger internal policies, processes, and procedures. Some of the verbal feedback that we've gotten from organizations on how they strengthen their policies. One organization in particular worked with their human resources department to develop stronger pathways for CHWs to be promoted from CHWs to CHW leads or CHW ones and twos or supervisors. Those pathways in that particular organization didn't exist before. And so we're really excited because we know that most CHWs, this might be a stretch, want to remain in the profession. They don't want to use this as a pathway to other healthcare work. And that's fine if they do. But for those that don't, we need pathways for them to be able to stay in this role and advance. Um, Raising awareness locally and nationally. It's bringing greater visibility to the impact and value of CHWs, highlighting Tennessee's work. And even today, we're able to raise awareness about CHWs in this meeting, which I know where most of us are aware here, but just presentations like this on accreditation, we're able to share CHW work with others, legitimizing the CHW work. So this reinforces that CHWs are essential parts of our healthcare community systems. It elevates best practices and professional standards, and again, leading to sustainability. While we haven't figured out reimbursement, the conversations are still going on, and we're still very hopeful. And again, this might help inform future funding and policy opportunities for CHWs and reaccreditation. Um, it helps ensure that programs continue meeting the standards. And even without reimbursement in place, we have organizations who still want to be reaccredited when their 3-year accreditation is up. And then just some of the challenges, affordability. So right now, organizations have the grantees rather, they haven't had to pay to go through accreditation. So it's been affordable. We're hoping that we'll be able to keep the cost low, but there will be a cost in the future for accreditation. And so we're working on figuring out how to make it affordable for both small and large CHW programs. And so we're working just to figure that piece out. Time constraints. Programs have limited staff capacity and competing priorities. And so pulling these documents together for the review process is time intensive. And so again, we're just making sure, we're trying our best to make sure that this is as smooth as possible, and that they'll have more than 6 weeks in the future to get their documents together and upload it. Reviewer pool and staffing. So this is a little bit of a challenge because the CHW community is large and small at the same time. And so we have to make sure that our reviewers don't have any conflicts of interest. And so this program has gained in popularity and lots of people want to be accredited. And so in the future, we might have a little bit of a harder time finding CHWs without conflicts of interest to serve as reviewers. So we're looking into how we'll be able to address that now, and to make sure that we still have CHWs who are serving as reviewers. We are not going to conduct a site review without CHWs present. Um, of course, long-term sustainability, just how we can sustain this beyond the pilot phase, how accreditation might connect to future CHW funding and sustainability, and continuing collaboration with partners. So we're just, again, the conversations are happening, but the challenge is we haven't reached it yet. We haven't reached a consensus, or we haven't implemented reimbursement. So how else can we sustain this program? And then finally, competing accreditation programs. This program has become so popular that now there are other models out there. And so um, we just want to make sure that the multiple accreditation models don't create confusion around the standards and expectations for CHW programs. I think this is very similar to what we say about even certification and creating national standards. We just don't want people to be confused. And we want to make sure that CHWs are central in every process like they were in ours. And so competing programs, just making sure that we're all aligned, but it also poses as a problem, or not a problem, but a challenge rather for us, because again, sustainability, how are people going to know which one to choose? So these are just some things that we've been thinking about. But again, we're working on ensuring that our process remains CHW centered, and reflective of the community and that we serve in Tennessee. So those are just a few challenges, and I will stop there and see if anybody has any questions. And I'm actually going to stop sharing so I can see the screen.
Nikela, there's some questions in the chat. One of them is, will these slides be shared? And Kim answered that one, but there was one before that. Oh, can CHW be supervised by another CHW outside of the organization?
That's a really good question. Because we have had to address that because again, we know some of our, and I guess let me make sure I'm answering this correctly. Some of our rural clinics share CHWs, and a supervisor might be at one clinic, and the CHW might be somewhere else. But that CHW, it has to be a person that they report to who's familiar with the work. It can't just be a random supervisor, a CHW assigned to a random supervisor. I hope that that makes, I don't know if I answered that question correctly or if I understood correctly.
It, see, the question came from Jan Plummer. Is that, did that answer your question, Jan? Or would you want to come off mute and clarify? No? Okay. And I guess you answered it correctly.
Okay.
Another question is it the CHW Foundation training program?
I'm not sure that I understand that question.
I'm
If they would like to come off mute, or someone else might understand.
not quite sure.
I'm not sure if they're talking about the Foundations program. I can't remember the author of that book. But if that is the question, no, this is something that we designed in Tennessee. So it's not linked to the foundational training program.
Okay. And I think CHW was able to operate as sole proprietors, and if so, do they have to undergo accreditation?
So this is a good question. Right now, no one has to undergo accreditation. It's definitely by choice. It's not linked to any form of reimbursement. So it would be totally up to any CHW program if they want to be accredited. In the future, we don't know that. We believe that CHW programs would need to be accredited for reimbursement in Tennessee, but that is definitely not a fact yet.
Okay. Okay, I got a confirmation that the question was answered.
Okay.
And then there's some the, okay, there's another one is, what is the approximate cost of the training and who benefits from it?
What is the of the
What is the
training?
approximate cost of the training and who benefits from it?
Go
So
ahead, Barbara. I see you
I,
came off
I
mute.
just want to clarify. I know that community health workers don't pay for it, but I wonder if you have yet computed what it really costs somebody so that we know how much money we need. And then do we also, have we started yet a list of who benefits when people get trained? So the state benefits, the local agency benefits, the person benefits. But if we could get that list together, that might suggest people we could go to for money.
Very good point. Yes. So we have started a list, but I looks like I need to reach out to you to make sure we have a complete list. And as far as cost, we have an idea of how much it would cost for accreditation. We're still fine tuning that cost because we've got to make some decisions in the future after this pilot what it'll look like. So as soon as we get those costs solid, we definitely don't mind sharing so that people will have an idea in other states if it's something that you're interested in.
Okay. And this one is this specifically to Tennessee organization only?
Right now, Um, we're just working with the grantees in Tennessee. In the future, if organizations want to be accredited, I don't see why we wouldn't open it up to organizations outside of Tennessee. But right now, the pilot is just for Tennessee. But
Okay.
this pilot is going to end this year.
Okay. And how can a community health worker foundational training organization become an approved training in the state of Tennessee?
Good question. We don't have that in place yet. That is something that the Tennessee Community Health Worker Association board is interested in. We've been meeting and discussing, but we don't have, like some states have a board that approves curricula. We don't have that yet. That is one of our future goals.
Okay. Um, I guess this the last question is, do you have a list of CHWs that are on payroll on compensation system as evaluators?
We do. We why are you trying to that's from Shantony. Are you trying to steal my reviewers? Is that why you're asking that question?
No, no, maybe, who knows? Maybe I'd be moving to Tennessee with such an amazing program. I may want to be on that roster. Or
Look,
what? How do I sign up?
yeah, and seriously though, that's not. I think I mentioned that we're going to need more reviewers, and you are a sister city. You're familiar, like especially with our East Tennessee. Um, all of that to say, more to come because we are going to need more reviewers because more of our programs are wanting to be accredited. But yes, our reviewers are paid. We pay them for their time. So we pay CHWs and their co-reviewer the same price, the same rather compensation, because we want to make sure we're being fair to CHWs. But yes, they get paid, and I think that's a good point, Shantony. And when we need more reviewers, which will be in the near future, I think I can recruit from this group,
Thank you.
and you'll be at the top of the list.
Oh, Stephanie's already checked me. She said, hold up, wait a minute. So I guess I gotta sit down.
Okay, are there any more questions for Nikayla?
And I just want to highlight what Barbara said. The accreditation system is laid out clearly and would be pretty easy to use in
Oh,
other states. And she's right. So if you would like our assistance, we would serve as consultants. So please reach out to us. We've spent a lot of time building this out, lots of lessons learned, and we definitely are here to help.
okay. Terry.
Oh, this is just absolutely incredible. And it's something that we've dreamed of doing for a while. The big piece is how do you pay for it? So thinking about sustainability, do you have some ideas about how to make this sustainable going forward?
Yes, so this is what keeps me up at night, seriously, because again, it's not linked to reimbursement. So what we're doing for sure is looking at competing organizations just to make sure that we are being fair in our pricing, in our, what will require as far as payment. We wish that we could do it for free, but we certainly can't. But we're just trying to keep our costs low. And we have put out information. We've been in contact with our state health department and of course, this is a TennCare state Medicaid project just to see if there are other ways to offset costs because they believe in the programs also. We're hopeful that even with the rural health transformation funds, at least for 5 years, we can help get costs offset through that. But as far as long-term sustainability, we're still working on that. And if you all have any ideas, we're definitely open to them because the programs that have been accredited, they want to be reaccredited, but if it comes down to saving a CHW role or making other decisions and being accredited, you know, of course, what are you going to choose? You're going to choose to put your money where you need it the most. So any ideas would be helpful for us.
Well, one of the things that we were thinking about was if you are, say, designated a stroke hospital, right? You pay for to be certified, you pay an application fee, you pay to be recertified, all of that. But like you said, that is really tied to a payment model.
Yep.
So really thinking about the advantages from Medicare as well as a Medicaid, and maybe even others, right?
Hmm.
Other payers along the way. So maybe that's part of that magic piece. But wow, well done! I'm so proud of you.
Thank you.
Wow, just great, awesome.
Thank you. Thank you. And let's all thank Nikayla for the excellent presentation that she shared with us today. And the plug that I want to put in is Nikayla is a true community health worker. Not that we all aren't, but she is a true, because she and I have worked across states providing services to clients. I'll get a client with an issue, and I don't know how it's connected to Tennessee, but it is, and she always come through. So I just wanted, so I was glad to be able to facilitate and introduce her to the group today.
Thank you.
Okay, you're welcome. And we're at time now to move into our next part of the agenda, and that comes with community updates from Soledad.
Yes, good morning, everyone, and thank you, Nikayla, for the amazing presentation.
Yes,
Yes, thank you. I am so happy to see everybody this morning. Good morning, good morning. Okay, so when you see me, you already know the first thing I'm gonna say. We all know what's happening in September, right? What is happening in September? Let me see it in the chat. And if you're going, oh, Ann already went, was the first one. Yes, the summit, the summit. Thank you, Bria. Yes, the summit is happening in September, September 22nd and 23rd. So we want all of you there. I'm gonna share, well, first let me put something in the chat. This link right here has everything you need, okay? And there is something that when Nikayla was speaking that came to my mind that we would like to have some people that is in this chat to present because there are so many expertise and not only that, just the live experience. It doesn't matter if you've been in this work for a month or 30 months, so we want you all to pull your team members, get them in the room. Not only that, submit their abstracts. So I'm going to share my screen for a second because the link that I provided you shows everything you need in just one click, okay? So once you click on the link, this is what it's going to look like. Let me move this box. This is what it's going to look like. You can click on the first link where you could get your tickets. It's going to bring you to the Eventbrite page, exactly what you see here. You can click, let me move this. You can click get tickets and you can choose if you're an ally or CHW. And we are still having early bird right now. So please get your tickets. Not only that, you all will get an email soon to announce our sponsors, okay? That email is going to come out. You're going to see who is sponsoring this amazing summit. We thank all of those who has been sponsoring, not only that, the exhibitors, because folks wants to know who's out there and want you as CHWs and allies, what they have to offer in this workforce. So we have folks who are just so excited. So once you click on that link, you'll see the opportunity to become a vendor or exhibitor or sponsor. And this is the part I was talking about that we would like you all to put in put in your abstracts to be a presenter. Okay, we're looking for poster sessions, we're looking for those to speak, we're looking for panelists. So we are really extremely open for different folks to come in the room and to just share with us what's going on, right? What are some of the studies you find? What is the information you would like for others in the room to know? And I'm going to pass it over to Julie for a second.
No, I just have a question for you, Soledad.
Oh, sure.
Can people submit abstracts to present in Spanish?
Oh, absolutely. Yes, yes. Please, if you are a Spanish speaker, you are welcome to present in Spanish. We're actually looking for you to come in the room.
Yes. And
Yes,
you can submit your abstract in Spanish if
yes,
more comfortable for you guys. So please feel free to submit your
yes,
abstract and say that it's going to be a Spanish language presentation.
yes.
There will be people who want to attend presentations in Spanish.
Mm-hmm, mm-hmm. And thank you for mentioning that, Julie. Yes, we are looking for you. Another thing that is new that we are doing this year, we are having an ally track. So if you are an ally, we will have specific sessions for you to attend, just to strengthen your work or the knowledge that you may be looking for, you already have to connect with other people. We will have a special track for allies during the summit as well. So there's so much to come and just a lot of things are developing. So once you click on the link, you'll see the opportunity to do that. You'll also see how we continue this conversation after our monthly meetings. The conversation continues at our the Mayan Vision app, right? Our communication specifically for the Southeast Network that you can see here. So you can see Tamika been posting, I've been posting, we've had Rebecca has been posting. So many of us in the Southeast Network. So if you have something going on, and I know the North Carolina Association, they have their summit going on this week, right? So any of you in North Carolina and you have some pictures to share, go ahead, share it with us. Any information that you would like for us to know, if you have a training going on, anything, click on this link right here to join the app. First, you would have to join the app and then come back and click on this link, and you'll be able to join the actual specific room. Also, in this link, to list the listserv, the meeting registration, and also our advocacy toolkit. You click on the link and you'll get the scroll down a little bit of what it looks like. Scroll down and then you'll see the advocacy toolkit. So you can share with your team. And just this is what was created within the Southeast Network. We're doing a lot of work and we're doing the work for you and with you. So I just want to thank you all for the engagement that you have been putting in the past couple of years, because we're growing because of the work that you all are putting in. And not only that, what you're looking for, we try our best to make sure that we implement it. So again, thank you. And I am looking forward to seeing you all in Greenville, South Carolina, in September. And I'll pass it back over to Lily. Oh, and one more thing, I'm sorry. We do have our planning meeting today at 1. So those of you who is on the planning team for the summit, we are meeting at 1 o'clock. And here's the fun thing. We get to look at the artwork submission today. So exciting.
And Soledad, I just wanted to add, we are still looking for sponsors.
Yes.
And in particular, y'all, you can do an exhibitor table for very low cost.
Yes.
So, even if your organization can't do like a large sponsorship because you don't have the funds, the exhibitor tables are like $250. And we would love to have a lot of exhibitors that have services you can sell, or anything you want to share about your organization. So please consider, you can reach out to any of us. The sponsorship information is also on that link that Soledad shared. We would love to have you guys be exhibitors, and or there's sponsorship levels for all budgets. And Barbara, I see your question. I will put it in the chat right now.
Yes. Thank you. Thank you. And let me give just a quick shout out to CHW Strength and LaShawn, the CHW network, they pulled on us to come and speak to their organization about the Southeast Network. So if you yourself would like for Kim and I to come and speak to your organization, we are more than happy to do so. So just contact Kim or I, and we'll be happy to support you in any way that we can. And I'll put my email in the, or you could hit email us Southeast CHW at mailbox. Yeah, I'm gonna put that email in there.
There's, there's another question in chat.
Oh,
How do let's see, what was it?
oh, how to
How do
apply.
you apply for the vendor table?
Yes. So when you click on the Eventbrite, is the first link in that link tree. You can, once you click on get tickets, once you scroll down, you'll see the options for different sponsorship level. So scroll a little bit and you'll see exhibitor. There's exhibitor table for nonprofit and exhibitor table for profit organizations. Yeah. So yep.
Okay. Are there any more questions, concerns, comments?
You're welcome.
Okay. Thank you, Soledad.
Yeah.
So now it's time for the state updates. I know we decided to limit your updates to 5 minutes, please. Um, so the states that we're reporting out is the first one is Florida. Is there someone here from
Hi,
Florida?
good morning. Dr.
Hey,
Lisa
Lisa.
here. Thank you guys for having us here. We're happy to announce that we were one of the Johnson and Johnson mini grant awardees. We're excited about the work that is being done on that project now. Um, the other thing happening here in Florida is just the Rural Health Transformation Program that is driving everyone crazy. I've been asked by the state to represent our coalition. Not that they're listening to anything I say about CHWs, but I'm fighting over here, guys. I am fighting for my CHWs statewide and trying to stay healthy. And so I think for us, that's all that is happening right now. Karen, did I miss anything that you would like to? Karen Harwood is our policy co-chair. Um,
So I was wondering if it'd be worth mentioning the workforce issue.
yeah, here in Florida, our career source has decided to remove the CHW credential from the list of um, jobs, sought after jobs, because the pay rate of CHWs here in the state is so low. That's not our fault, right? And so, how you're going to say now that uh, our credentialing for that process is is not optimal? And Karen, feel free to add in. So
Yeah,
it's a new policy issue, is what I'll say.
the we had applied to be our organization in particular applied to be a education provider through Career Source. So that would allow people that are unemployed to get the training to hopefully get them a job in the field, which would be an amazing opportunity. Uh, we have been a licensed school for 4 years in an effort to get this approval. We were approved by the state to be an education provider. And then about 2 months ago, we got a notification from the state that several positions were going to be removed from the list of education providers. And I just received an email yesterday that our county is not even, they were going to bring it before the board in June and they decided not to. And I think it has something to do with this state letter. And when you look at the positions that are being removed, a lot of the job titles are community health worker, healthcare. What's also interesting, EMS, paramedics, all these healthcare related positions will no longer be funded through workforce development in the state of Florida based on, I think it's really a lack of cohesiveness with the job titles and effective, efficient, appropriate reporting of the salaries that people are earning. And so as a result, it's just not jiving. And so the work that people are doing and the value is not being appropriately documented. So it's just a challenge that we're experiencing, and I'd love to see if anybody, has had any success with their workforce boards and um, what if people have experienced something similar.
Oh, thank you, Karen. I'm going to turn it back over to Lily.
Okay. Thank you. And let me say this right here. I know I said I gave a shout out to Nikayla, but I want to sum it up for fear of offending anybody and leaving anybody out. I've worked closely with several of you on here as far as referring clients across county. Why am I saying this? Because I just want people to know that CHW don't just, we talk about working across boundaries, but we also work across states as well. Okay, thank you. Now, let's hear from Georgia. Is there anybody here from Georgia?
Yes, good af or still morning. Good morning,
Good
everyone.
morning.
Aisha Williams. I'm the Deputy Director at Archie, and we help oversee and lead the Georgia Community Health Worker Network. As many of you, I think we have mentioned before, we did submit for legislation this session, House Bill 291, I believe it was, for statewide certification. Um, and unfortunately, it did make it through the House, but it did not make it to the Senate floor for a final vote. So we, for the third time, were unable to get certification passed. So we are exploring some other pathways for certification and hoping that we'll be able to, get certification through a different pathway, but we will also still introduce new legislation in 2027. And in the interim, we were a recipient of the Johnson and Johnson funding, and so we will be utilizing that to continue to build momentum throughout the state, building momentum in some of the rural communities, and helping to just identify additional community health workers and their impact that they're making, so that some of those no, just to raise awareness throughout the legislators about the work that's happening in their districts. So, we are going to be making that momentum for that. Um, we will also be sending some community health workers to the CHW Summit. So we're excited about that and to have Georgia represented in September. And we are also hosting our own statewide summit on June 3rd. So we're excited about that. We have about 200 folks registered. So we're looking forward to recognizing Georgia community health workers through our awards. And we also will have about 9 different breakout sessions that community health workers will be able to participate in to just increase their professional development and learning. So we're excited.
Thank you, Aisha. And North Carolina, and I'm gonna read their regrets because they said that they will miss everybody here, but the team is gearing up for this year's North Carolina CHW Summit in Cherokee, North Carolina on 5/20 and 5/21. But it would definitely share out, they'll share out afterwards and they appreciate us all. Okay, next is Kentucky. No one here from
Hi,
Kentucky.
sorry.
I'm sorry.
Taking a second to get my mouse going. There we go. Hi, I'm Malia Huff-Young. I work with the Office of Community Health Workers in Kentucky and the Department for Public Health. I didn't see Angela on from the association, so when I pop in, we are also working on moving towards our conference, and it's going to be in August this year during CHW Appreciation Week. So we just are call for speakers just closed. So we're getting ready to review all those wonderful applications. Lots of interest in Medicaid reimbursement and billing, and lots of harm reduction, overdose prevention kinds of applications. So we're really excited this year, although we are missing our Southeast co-planners from last year. Taking some of those ideas that you guys came up with and for the future. And within that, we have our certification program going, of course, for the last few years, but we have our Certim application platform for managing certification. So we've been a couple months into that, and it's been going really well. If anyone's interested in that kind of like platform, it took a while to get up to speed, but it's been great to have our next test. Our next stress test of it is when we go for CHW recertification that we do every year in the fall. So getting ready to test the system to see how easy it's going to be for us and for all of our certified CHWs to get all their information updated. Also working on our rural health transformation plans. It's been, an interesting challenge. It moves really fast, which is not always the speed of CHW work, ideally, but they are putting money into CHW programs, so we're excited to see how that's going to turn out. Trying to pull all of our resources together, so any scaling up of CHW work that's going to happen in the state as a result of that is going to be supported by all the wonderful experiences in Kentucky CHWs and other states. So definitely curious about following up with the Tennessee accreditation program and seeing maybe not if we may not be doing the accreditation of organizations, but certainly let me know what an ideal organization looks like and for CHWs and how to articulate that and share it for all of our partners. So I don't know if anybody else from Kentucky wants to share, but that's all I have on my mind.
Okay, thank you, Malia. Next we have Louisiana.
I'm here, Lily.
Hey,
Good
Catherine.
morning. Good morning. How y'all doing today?
Good morning.
Um, what do I have to report? The first thing is that we had an election, and Louisiana just was very great in voting down all 5 amendments, which were clear that our governor was really pissed off at, excuse the language. And that's a good thing. Um, I'm sorry for my language, y'all. Please forgive me. Well, no, don't forgive me. That's just me. Um, we've been having cancer trainings, which is funded by Sanofi. We have our last one in June, so we've done regular general information and lung cancer. We did cervical cancer this month, and in June we'll be doing colorectal, and then we're finished with that. Hopefully, we'll be funded to do some more. Um, what else I want to tell y'all? You guys have been talking a lot about the rural health transformation. I want you to know we were not at the table. We were not invited to the during table, but we do have allies who bring us information back. So we're just trying to figure out what's going on with that, because it's not that funds are going to uh, like funds are going to places like LaShawn or CBOs. It's going to hospitals and whatever. So we're not sure what's happening with that. What else I want to tell y'all? There is a summit, Rural Health Transformation Summit, and we're going to have a table just to talk about LaShawn. That's June 11th. And there was something else I wanted to tell you guys that's happening here. Oh, one happy thought. Most of you know Ashley Winterstrom, and you guys know she has been an associate professor for a long time, but she is now a full professor, which we are so happy for Ashley. She deserves that. And We have a recall. We have a recall petition for our governor too. We have long, long lines going on. So there you go. That's my report for Louisiana. Thanks.
Thank you, Catherine. Uh, Next, we have Mississippi.
Good morning, everybody. Can
Good
you all hear
morning.
me?
Yes, ma'am.
So, for those who don't know, my name is Kismet Cleveland. I'm the executive director for the Mississippi Community Health Workers Association. If you hear background noise, I'm at a conference. So I'm gonna make it brief. I want to say congratulations. We are one of the recipients of the mini grant from Johnson and Johnson to do really some strategic planning work. Um, that is something that in North Mississippi, so for those who know closer to Memphis or to the Alabama line of Mississippi, we have very low visibility of community health workers, and that is something that is something that is needed. We have a lot of visibility of CHWs in the Mississippi Delta area and state capital area of Jackson and the coast, but other parts of Mississippi is very low. So we're so excited about that to get out the boots on the ground work and to recruit and to engage with community health workers and those who may not even know they're community health workers across Mississippi. So our CHW summit was scheduled for June 3rd and 4th this year. We have postponed it. We have not come up with a new date. And one of the reasons why the state of Mississippi Health Department has not come up with a process for certification for CHWs. And that has been something that I have been getting a lot of calls about. When is the process? What is it going to be? And I just didn't want to have a summit just to have a summit and not have some meat and potatoes for CHWs and their supervisors coming into a summit with no questions or no answers. So we have postponed it. Hopefully, the health department and Medicaid, our state Medicaid, will have that information for us. For those who may not know, Mississippi, um, it was ruled back in July of last year, it went into an effect, and it was supposed to start January 1 of this year. And I'm going to leave that right there. We have scheduled roundtable discussions, like I said, across the state to engage CHWs and something new. We now have a section with the Mississippi Public Health Association. So it is really new for those who are familiar with the national APHA and our previous Mississippi Public Health Association. Dr. Kay Bender, that was something when she retired, she wanted CHWs to be at the table. And so now we now have a section. And I'm also asking for anyone with experience, if I could reach out or pick your brain on what that looks like. The executive director, myself, and for those who may know, Mr. Robert Lee from the health department, we are right now co-chairing this section until we can find some CHWs or recruit CHWs to actually lead the sections. And so I need some help. Because this is new. I have not, and just for those who may know, Dr. Susan Mayfield Johnson is a part, but she is in the background, not to really disturb her, but we're trying to move forward with that, and she's given us suggestions. Um, so yeah, so this is something new we're starting, and yeah, so that's it for Mississippi.
Okay,
Thank
thank you.
you.
Um, Thank you all for all those wonderful updates. And just another step for moving forward for the boots on the ground. So now for the final discussion, we'll turn it over to Kimberly Rollins.
Thank you so much, Miss Lily. I'm going to go ahead and launch today's evaluation. We ask that you please complete it to share your feedback about today's session. And while you are completing the evaluation, I do want to share an update as well as a reminder. So I know you've heard a couple people today share about the mini grant opportunity, and we just want to share a little bit of information about that. This is not a public facing funding opportunity. This went directly to the CHW associations, coalitions, and groups in each state. Each state had an opportunity to apply for a small pot of funds, which ended up being a little over $7,000 to support efforts within their state to build capacity, as well as to increase engagement in the network from their state. So they had an opportunity to choose from a menu of opportunities, what they wanted to do in their state based on what the needs were. And those different categories included CHW training, credentialing, and career advancement. Then there was CHW leadership, retention, professional support, and skill building, CHW network membership and engagement support, convening, peer learning, and community building. And finally, the last option was workforce engagement, outreach, and pipeline development. And they had an opportunity to choose one of those or all five of them if they did choose to. If none of those align with their needs, there was an other option where they could put what their needs were, but we didn't have anyone to choose other. So most of the states that applied did choose from the options that were available. We are happy to report that 9 of the 11 states completed their short application and will receive those funds soon. And there will be more information coming soon about what they chose to work on as part of this mini grant opportunity. It's a very short time frame, but we were given some funds and wanted to provide those to the CHW organizations to support their work moving forward. Also, a quick reminder that I want to share is that we have a webinar coming up, and we would love for you to be there. It is next week on May 27th, and I'm trying to get the link to put in the chat. Give me 1 second. It is the Unpacking the Complete Community Health Worker Financial Sustainability Toolkit webinar. And it is next week on May 27th at 1 p.m. Eastern Standard Time. This is an open webinar, meaning that there is no registration required. You have to put the information on your calendar. And within that link that I just put in the chat, there's also the link for Zoom access. So you just need to hit that link and join us next week. This information has been shared widely and has been shared through the network's listserv, and we will share it again. But that is the information in the chat via that link that you can learn more about what will be discussed during that 90-minute webinar. So at this time, I'm going to open up the floor to see if anybody else has any announcements or comments that they would like to make at this time. And Anna, I did see your message, and the floor is yours. Go ahead.
Hello, everyone, and thank you, Kim. My name is Ana Cosillo, the training manager at PASOS, a nonprofit organization in the area of Columbia, South Carolina. PASOS is pleased to announce the start of its upcoming community health worker core competency training. This cohort will start on June 8th. This 60 hours cohort have 80 hours of theoretical sessions plus 80 hours of in the field practicum activities. And this cohort will end around September, probably. I want to share also that we have been offering this cohort since 2021, and a total of 141 community health workers were completed successfully, and they became certified CHWs. Recently, we just knew that the 12 promotores that completed the first cohort 2026 passed the exam successfully. So they are also part of this group for a total of 153 CHWs that PASOS have certified so far, trained and certified. So we are excited to explore also opportunities to train community health workers from other Southeast states. And we would love to connect with interest organizations. So please don't hesitate to reach out if you would like to get more information about our training. And thank you for this opportunity. Thank you.
Thank you, Anna, for sharing that information.
Of course.
Congratulations. Is there anyone else who would like to share at this time? I know there is a collab, and I believe it's happening tomorrow. I'm not sure if anyone is still on from the South Carolina team who can give us a quick update on that and let folks know if registration is still open.
Kimberly, I'm here. Hang on just one second.
Okay.
If you don't attend the collabs, I just really encourage you to take advantage of it. This is an opportunity for all of us to really work together. So this one is going to be called Rooted in Community Building Vaccine Confidence Through History, Family Voices, and Local Practice. And this is going to be great information. The association will be following up with some more information in June, but boy, this is going to be a good one. And I think it's going to be different than the kind of vaccination trainings that we've had in the past. So please keep that in mind. We'd love for you to join us every time. So and you do get a CHW CEU for attending each one. Thank you. Oh, wait a minute. I can drop the registration link. How about that?
Yeah, I just put the link in the chat for you.
Oh, thank you. Thank you, Kimberly.
You're welcome. Anybody else want to share? You have an upcoming event, want to make a comment about anything you're doing? This is the opportunity to share.
Hello, I'm Lori Hoffman from the Tennessee Community Health Worker Association. And Nikayla mentioned earlier we're having an informational session this Thursday, and I just put the link in the chat. We are launching our training program, the Tenchwa CHW training program that we have had a pilot going on for 3 years in the state, and we're now launching it in a new model. So if you are interested, please come and follow that link. Thanks.
Thank you, Laura. Anyone else? All right. The evaluation is still open, so if you've not had an opportunity to complete it, please complete the evaluation. We do review these, and we, as Soledad said earlier, take your feedback and your comments seriously and try to implement those changes as best we can, because this is our network and we want it to be reflective of that as well. Anyone else want to share? If not, we're going to close this portion of the meeting. And I have one other announcement, and then I'm going to turn it back over to Lily for final comments and to close us out. So just as another reminder, our next meeting will be on June 16th And this will be a special session that you don't want to miss. And there will be more information coming soon about what we'll be doing on June 16th. Thank you so much. And I'm turning it back over to you, Miss Lily.
Okay, thank you, Kim. Thank you all the presenters today, all the updates, all the comments, all the whatever that was shared with us in this space today. I just want to remind you that the third Tuesday of the month at 10:30 to 12 o'clock is when our Southeast Network meeting is. And as Kim just said, the next meeting will be June 16th. Um, And I am delighted to have facilitated this session today, and I've learned so much information, so many things that I can add to my daily activities as well. And so good to see so many of your faces. I know sometimes I see you and I'm like, you say, "Well, hey, how you doing?" And I'm like, "Fine." Well, sometimes I remember the faces, but not always the names. So just chalk it up as being aged. I'm one of those seasoned people that can't remember names always. So just remember that's what it is. It's nothing intentional, all but love. All right. So if there's nothing else today, we will gladly return you 8 minutes of your day and hope everything goes well and keep on keeping on for the Community Health Work Organization. Thank you. Have a good day. Bye.
Miss Lily.
Bye bye.